Welcome everybody, my name is Emiliano Albanese, I'm the director of the Institute of Public Health of the Università della Svizzera Italiana, and with Supsi and Professor Luca Crivelli, we are co-PIs of an ambitious program, an ambitious project that is part of the Corona Immunitas Swiss School of Public Health initiative that aims to give answers to how this epidemic has impacted our country. In Switzerland, as of the end of May 2020, the cumulative cases of coronavirus per 100,000 people was around 362. As a reference, this was 383 in Italy. However, the number of deaths for 100,000 people was 23 in Switzerland versus over 50 in Italy. There are huge differences in how this epidemic has impacted across countries, regions, and in different moments and times. And we need to understand this impact in different countries. But to what extent can we rely on the available data and the numbers that every day we're looking at? It must be said that the current definitions and indications of the cumulative tests is essentially based on the swabs and the PCR tests of the presence of the virus, but these changes and the criteria for which people may be tested varies a lot over time. The World Health Organization recommends to rely primarily on seroprevalence-based studies, in which essentially we obtain information about the actual immune response to the infection that may have happened in the past. It is a much more reliable indication and a measure for the cumulative cases and many other aspects of the disease itself. These surveys may be conducted in the general population on representative samples so that the data can be extrapolated to everybody, but also are very relevant in some subgroups like health workers or vulnerable peoples, because this information is crucial overall to inform policy decisions and how and with what timing we decide to do things like reopening schools, or allowing people to reducing physical distances and many other measures of this kind, but primarily to reduce the impact of a disease and its recurrence and reduce and keep limited the number of infections. Serosurveys are, however, extremely complex and long studies to conduct and require a very important multidisciplinary collaborations that implicate several stakeholders and many competences at the local level. Crucially, the empowerment and the engagement of communities with these studies are conducted is a fundamental ingredient, because we not just want these people to contribute to the data participating in the study, but they should co-design the study themselves, discussing what measures should be integrated, and then we should gain a collective, better and a good understanding of the results that we produce collectively. In this video, I just very quickly would like to illustrate to you that in Ticino there is actually ongoing a program that we may call a Serosurvey. And it's a program because it's articulated across different projects. There are three main projects right now on seroprevalence. The first one, called COV2IG, is a serological study conducted in health worker. And this is done through a collaboration between hospitals, including the COVID-19 hospital centers in Ticino at EOC, Clinical Mocucco and Hildebrand, but also in close collaboration with the Institute for Research in Biomedicine, or IRB, and WhoMAPS, which have developed jointly a test to determine the immune response across IgM, IgG and IgA. The study is ongoing and several thousand people have enthusiastically participated and provided their blood, on which has been done this testing. And we have the first and initial preliminary results on this very important population. The second study in this program is by the Chief Medical Office in close collaboration with the Ticino Medical Association. And in fact, thanks to this collaboration, more than 100 doctors in the Ticino canton are made themselves available to assist the Chief Medical Officer to recruit participants from the general population, a representative sample randomly collected, essentially randomly convened through letters sent to their homes by the Chief Medical Officer, and the family doctors to take a simple test, a kit which is commercially available to simplify the process. This study as well is now ongoing and has started a few weeks ago and will provide very valuable information, because this is a cohort study, so the same 1,000 people will be followed over time, and so we will acquire information not only of how many have been infected, but also very important information about the acquired immunity, that is the persistence of the immune response, and whether these people tend to have or may have new symptoms or maybe even reinfected.
My name is Luca Crivelli. I am the Director of the Department Business Economics, Health and Social Care at SUPSI, the University of Applied Sciences and Arts of Southern Switzerland. Let me now present the third project, Corona Immunitas, which is a Swiss-wide research program for the collection of epidemiological data on immunity to SARS-CoV-2. This study is part of the SSPH Plus Corona Immunitas initiative, with the support of the Federal Office of Public Health. It aims to also explore and understand the broad impact of the COVID-19 outbreak in the general population, ranging from the socio-economic consequences to psychological and mental health issues. This is a unique opportunity to design and conduct a study which is aligned with the national standards in order to allow for comparability, but at the same time, which is tailored to the culture and contextual situation of Ticino. The Institute of Public Health at USI, together with my department at SUPSI, joined forces to design and conduct Corona Immunitas by combining their expertise and rich networks of stakeholders and partners at the cantonal level. We plan to recruit a randomized sample of the general population. However, our specific aim is to focus in particular on young and older adults. The complementarity between ongoing studies at regional and national level shows the importance of coordinated actions. The knowledge about the broad impact of the COVID-19 epidemic and the data at the local level is in fact our best hope to inform our response and to reduce the huge burden that this exceptional situation is exerting on the individuals, communities, on the economy and society at large. Corona Immunitas is an epidemiological study conducted for the population, on the population, and with the population. We really need your participation and support. Thank you so much.